This year, this semester is very different from the past years. And for the past lectures, I will be able to show the physical examination of the neck, especially for the examination of the lymph nodes and the examination of the thyroid gland to you guys in real model in your classmates. But this year, we have some difficulties to see you guys in the classroom, so it could be a pity that I cannot show you how to do the physical examination. But anyway, you may be able to learn this from some videos or some other kind of methods that will show you how to do this physical examination. So first of all, I would like to continue with the second part, is the examination of the neck. As I introduced yesterday, there were 4 different principles for physical examination. One is the inspection, palpation, percussion, and auscultation. And the inspection, we need to check what kind of things we need to check for the neck, and should be inspected for the asymmetry. If the neck is a asymmetry or asymmetry, unasymmetry. And if the patient have the limitation of the motion, also if the patient has some abnormal pulsation from the neck, and if any goiter here from the enlarged thyroid gland, as well as the masses from the neck, head and neck region for the inspection for this kind of masses. And other things like the scars from past surgery, and this will give you the history of the past disease. The neck scar, like the scar from the thyroidectomy or tracheostomy, and all of this give you the clues to some certain diagnosis of the disease or situations. And let's repeat this first. The anatomy of the neck. For a normal person, you identify all of these anatomy markers, like the larynx, and this under the larynx, you see the rings here, the trachea rings, and the clavicle bone here, and also the muscle, very prominent at the neck, is the sternocleidomastoid muscle. And then the surrounding of the trachea and the larynx is the thyroid gland. The thyroid gland includes different parts, which are the thyroid lateral lobes on both sides, and the bridge between these 2 lobes is the isthmus, 峡部, 甲状腺峡部, and all kinds of these anatomical markers are important for physical examination and to identify the pathological situation. A systemic approach to the examination is as follows. First, you have the patient's neck relaxed by ask the patient to chin down, and then ask the patient to chin down to relax the muscle, relax the skin, and then you'll be able to do the physical examination. Then the posterior natural neck are palpated for lymph nodes and masses, and then after the patient chin down, and then you'll be able to do the physical examination for the posterior lateral 后外侧颈部 for the palpation of lymph nodes and masses. and followed by checking of the front cervical triangle, searching for any enlarged lymph nodes and tumors. Then the parotid salivary glands and the preauricular lymph nodes. Then the tracheal position is determined for deviation. So this is the general sequence for the physical examination of the neck. Ask the patient to chin down, and then you'll be able to check the posterior lateral part of the neck, and then the front cervical triangle, 前三角、后三角, jugular lymph nodes, to see searching for enlarged lymph nodes for the jugular area, just as I told you yesterday. And then also check the tumors, any tumors from the neck region and enlarged lymph nodes. Then the parotid glands, salivary glands, and the lymph nodes of the preauricular areas and the postauricular areas. And then the tracheal position, how to determine if the patient have a midline lining very well trachea. We'll see if the patient has any deviation of the trachea. This means 气管是否居中. If the patient has any deviation, 气管向左偏还是向右偏. We often use 3 fingers. These 2 fingers you put on the joint between the sternoid bone and the clavicle, and then put the ring finger and the index finger, and then you check with your middle finger to see if the trachea is in the middle position or if the trachea have any deviation to the left or to the right side. So this is the checking method for the tracheal position. Okay, the next I would like to talk the physical examination for the cervical lymph nodes. As I introduced yesterday, we have these many groups of the cervical lymph nodes, including the segmental, submandibular, and then preauricular, postauricular, occipital, and then we have this poststernocleidomastoid, posterior angle, triangle, cervical area, and jugular, which we call anterior triangle, and this is the cervical lymph nodes. And there are 2 other groups, the supraclavicular groups, just above the clavicle bone. These are the supraclavicular lymph nodes, and also the ninth lymph nodes is the pretrapezius lymph nodes. Okay, and before going into the detailed sequence for checking these cervical lymph nodes, I would like to introduce Virchow's lymph nodes, often identified on in the left supraclavicular region, which is named after a person, Virchow. So this is called Virchow's lymph node. And this is another demonstration for the cervical lymph nodes. It's a little bit different from the previous one, but this shows the lymphatic system drainage to different groups of the lymph nodes. You can see this segmental draining area from the chin here, and the submandibular, the draining area from the face, from the cheek, the preauricular area enlargement. If any enlargement of the lymph nodes here, the draining area, the lymphatic draining area is the the scalp and also the ear, post-auricular draining area, occipital area, and also if you identify some enlarged lymph node in the jugular triangle or the posterior triangle, which means the draining area of the lymphatic system to these lymph nodes, you may be locate the disease from which region. This may give you some suggestion of the affected organs or the other situation. Like if these groups of lymph node enlargement, this is the draining lymph nodes from the tonsils. If the patient has the inflammation of tonsils, then these groups of lymph nodes may be enlarged and maybe have some pain from this region. Okay, and there are also some lymph nodes behind the sternocleidomastoid muscle, which called deep cervical area. And the draining area of these groups are from the superficial cervical area, from the superficial to the deep cervical area. So if the patient suffers from nasopharyngeal cancer, BNI, they may have enlarged lymph nodes from these areas. And so the physical examination for the neck to check the lymph nodes are very important, and this is the key points of today's lecture. Okay, I would like to introduce the virtual lymph nodes. We like to give this definition for the describe the definition of the virtual lymph node for your test. Sometimes you can see in the supraclavicular region, you identify two masses, and these masses are what we call the virtual lymph nodes. They are solid and without tenderness, and sometimes they made it together, and the mobility is very, very poor. They stick together, and these are fixed masses. And this is the indicative of the metastasis lymph nodes from gastric cancer, pancreatic cancer, esophageal cancer, and sometimes lung cancer. Okay, if you found a draining lymph nodes like this in the supraclavicular region, this is what we call virtual lymph nodes. And very recently, I have a patient that we were able to identify the virtual lymph node, and she suffered the biliary tract cancer, 胆管癌. So this is not definite a specific metastatic site for special disease. If you identify the virtual lymph node, the suspected primary site of the tumor could be different. Could be gastric, could be pancreatic, could be biliary, and esophageal, and sometimes the lung. So pay attention to check the supraclavicular area to identify if the patient has the virtual lymph node, especially to the left. I don't know why it's the left, but most of the virtual lymph nodes were identified in the left supraclavicular area. Okay, so this is the virtual lymph node. And another key point of today's talk is the palpation of the thyroid gland. This should be done with the patient seated in a chair while the physician examines the neck for both behind and in front of the patient. So you have two different methods to do the palpation of the thyroid gland from behind the patient or from in front of the patient. And as we remember, the anatomy markings here, the larynx, the trachea rings, and the lateral lobes of the thyroid gland and the isthmus. So which location we should put our hands or fingers on is just like this, okay? If you stand behind the patient, you can put your fingers like this. From behind the patient to check the thyroid gland, you put your 2 thumbs behind the sternocleidomastoid muscle, and then put the other 3 fingers, the index, the ring finger, and the middle finger together, and put them over on the thyroid gland. You identify the larynx easily from the male patient, but for female, how to identify these markings? You can check the trachea rings first to do the palpation to see where are the trachea rings, and just above the trachea rings is the thyroid gland. And for the lateral side, you can identify the lateral lobes of the thyroid gland. And in the middle part, just the upper border of the trachea ring is the isthmus of the thyroid gland, okay? Then this is a typical presentation, the typical image for the thyroid gland physical examination. The physician just stand behind the patient. The patient sitting in a chair, and the physician just stand behind. And first, put the thumb just behind the sternocleidomastoid muscle, the thumbs, and then put the other 3 fingers just to locate where is the thyroid gland, and to identify the trachea rings and the larynx, and then do the palpation. If you would like to check the right lateral lobe of the thyroid gland, you could push the sternocleidomastoid muscle with your right hand, the index finger and the middle finger, push it upward, push it forward. Push this muscle forward and use your left hand to do the palpation. Push it to do the palpation, and then you'll be able to push the right lateral lobe to the left side, and use your left hand to do the palpation of the lateral left lobe of the thyroid gland. And then if you want to do the right side palpation, you can also push the left lobe to the forward, and then you use your index finger or middle finger to feel the movement of the thyroid gland. Ask the patient to do the swallow, to do this motion, to swallow some water, a small amount of water, to see if the mobility of the thyroid gland is good enough, and then you can touch the border of the right lateral lobe of the thyroid gland. Okay, so use your 2 fingers, push it to one side, and then you will be able to do the palpation for both the left lobe and the right lobe, the right lateral lobes of the thyroid gland. And this is the examination in front of the patient. The physician just stand in front of the patient, and also use 2 hands. You'll be able to, when you're do the physical examination, use your index finger and middle finger to put this finger behind the sternocleidomastoid muscle, and then use your thumbs to do the palpation for both the left lobe and the right lobe of the thyroid gland. Ask the patient to do the swallow motion, and to drink some water and hold the water in the mouth and do a swallow, and then to see the movement of the thyroid gland. You will be able to identify some nodules, some masses, and any enlargement of the thyroid gland. And you'll be able to do the right side and the left side of the thyroid gland palpation. So, both from the behind and from in front of the patient. If you want to check the right side, you use your right hand to push the left lobe to the right side, and then you'll be able to palpate the border, to palpate the texture, to palpate if there are any nodules. And if you want to check the left lobe, use your left hand to push the right lobe of the patient to the left side of the patient, and then use your right hand to do the palpation and ask the patient to swallow, and then to see the movement of the thyroid gland. So these are the detailed characterizations of the physical examination of the thyroid gland. And this image shows you a goiter. This is the enlarged thyroid gland. Here is very large. Just from the first glance, you can see this is an enlarged masses here, just in front of the neck of the patient. And this is a typical goiter. The patient may have hypothyroidism, lack of iodine, and then the patient suffers from hypothyroidism. And in Chinese, we call it 地方性甲状腺肿. And sometimes you can see this is the degree 3 enlargement of the thyroid gland. And just for the inspection is enough to make the diagnosis. But also you need to do the inspection, palpation, and auscultation. Auscultation, how to perform auscultation? You may be able to use your stethoscope to do the auscultation for this enlarged thyroid gland, and also what we call goiter. And auscultation, how to perform auscultation of the neck. We would like to hear if the patient have any bruise in the neck area. Put your stethoscope over the thyroid gland and listen carefully. If a systolic root hurt over the thyroid, it's almost diagnostic importance of a diffuse toxic goiter, which means the 弥漫性甲状腺肿. This is because the increased blood flow to the thyroid gland. 甲亢的时候使用这个听诊器放在甲状腺的上级 like this. Put your stethoscope on the upper part, the upper lateral part of the thyroid gland to hear if there are any roots that can be identified in this area. If any systolic roots hurt, that means the increased blood flow to the thyroid gland, and the patient may suffer from hyperthyroidism with a diffuse toxic goiter. 弥漫性的甲状腺肿 what we call Graves' disease is an autoimmune disease. Okay, this is the auscultation. And as I told you previously, today the content of today's lecture is not that much, and I would like to review this with you guys. There are some questions here, and the first one, these are the questions that you need to master, and you need to know the answer to these 3 questions. The first one is, what are the common causes of cyanosis? If you still remember, this is the, there are some clinical occurrence of cyanosis, like the sudden obstruction of the airway, and also the pneumonia, also the COPD, chronic obstructive pulmonary disease, and some heart failure situation, especially the chronic heart failure. And the fifth one is the congenital heart disease with the shunt from the right to the left. This kind of patients, these 5 different clinical situations, the patients may have the cyanosis just in the surrounding of the mouth and the tip and the nose and the nail beds will show the bluish color of cyanosis. So this is reminding information for you. What is the definition of the cyanosis? Is the oxygenation of the hemoglobin is decreasing, and then the hemoglobin will show into methemoglobin or subhemoglobin, which is showing the bluish color, and then as I told you, the patient will have the cyanosis from this the nose, the mouth, the surrounding skin area of the mouth, and the nail beds. This is the answer to the question 1. And for the question 2, what is the clinical implication of Virchow's lymph node? And as I told you, all the cervical lymph node examination are very important. You need to know the number of the groups of the cervical lymph nodes, including submental, submandibular, preauricular, postauricular, suboccipital, and then the posterior triangle, anterior triangle, and the supraclavicular area, and the pretrapezius area. All these cervical lymph node groups are important. You need to know the numbers of the lymph nodes, the number of groups of lymph nodes, and know where the location they are. And then the Virchow's lymph node is especially on the left supraclavicular region, the left supraclavicular lymph nodes. The enlargement of this group is called the Virchow's lymph node. And these lymph nodes are hard, very solid, and the mobility is very poor, and the patient may not have tenderness, show no tenderness if you press to palpate or press on the lymph nodes, and is indicative of the metastatic disease from some malignancy, especially gastric cancer, pancreatic cancer, biliary tract cancer, and also the esophageal cancer and lung cancer. Or this kind of malignancy may have a metastatic lymph node in the Virchow's lymph node region. And this is named behind a person, so whose name is Virchow. So the clinical implication of Virchow's lymph node is the metastasis of the malignant disease. Okay, this is the answer to the second question. Is the Virchow's lymph node, the clinical implication. And then the third question, briefly depict the skill for palpation of the thyroid gland. And as I just told you previously, you can have 2 methods to do the palpation of the thyroid gland. You can stand behind the patient or in front of the patient. If you stand behind the patient, you use your 2 thumbs behind the sternocleidomastoid muscle, and then push the muscle towards the front side, and then use the other 2 to 3 fingers. Your index finger, middle finger, sometimes use your index finger to palpate the lateral lobes of the thyroid gland, and ask the patient to do the motion of swallow. We do swallow to see if the thyroid gland can be moving together with the swallow, this action, okay? And to identify if any enlargement of the thyroid gland and any nodules. And if you are standing in front of the patient, you put your index finger and middle finger behind the sternocleidomastoid muscle and push it to you, to the front side of the patient, and use your 2 thumbs. Put the 2 thumbs on the lateral lobes of the thyroid gland, then ask the patient to swallow and to do the palpation of the thyroid gland. And before all of this, you need to know the anatomy of the neck, to know the markings of the anatomy, and then how to identify the location of the thyroid gland, to identify the larynx, identify the trachea-larynx, so that you'll be able to locate if there any pathological situation of the thyroid gland and do this palpation. After this, you would also like to do the auscultation for some toxic goiter. If the patient has increased blood flow to the thyroid gland, you may be able to hear the bruits from the upper regions of the goiter. So these are the key points of today's talk. And I'm very happy to have this chance to share with you the physical examination from yesterday and today's lecture. And yesterday, I shared with you the basic methods and the basic methods of physical examination. We learned how to do the inspection, how to perform palpation, percussion, and auscultation. And you need to practice again and again with your friends, with your classmates, and how to do the percussion, how to do the palpation. And this may be very important in your career life later on. And also, we need to know the clinical implications of some pathological situations or findings, and to know how to perform the auscultation and for the other body parts. And also yesterday I show you how to do the vital sign examination, such as the pulse, the respiration, the temperature, as well as the blood pressure, and also the anthropometric data that we need to record from the general physical examination for every patient. And then today, I show you how to do the physical examination for the head and neck, how to identify the pathological situation of from the general appearance, the faces, the skin, and from the eye signs of the thyroid disease, and also some different phases from the paralysis of the facial nerve, the Cushing disease, and the Creedings, as well as SLE, jaundice, and the mitral phases, all kind of this pathological situation from your first glance at your first glance on the patient. So these are all important and you need to know. And the second part of today's talk, I show you how to perform the physical examination of the neck. And these are the key points of today's lecture. So I'm happy to take any questions from your message board. Please feel free to leave me any messages regarding to any questions to yesterday and today's talk, and I will take a picture of the textbook that I use for your lecture and send it to somebody in your class, and then so that you will be able to read the textbook that we are using. And then if you have anything regarding the contents of these 2 talks or 4 talks, I'm happy to answer your question. So that's all for today's lecture. Thank you all for your attention, and the lecture is over. And thanks again. Bye-bye.